think some of the unintended consequences are some of the consequences that we never really saw. I think a lot of folks thought, oh, the ACA, everyone's going to be insured, and this is going to be great, and everyone will get health care, and that really isn't what necessarily transpired. Not to be a cynic on it, but I'm a patient person. I'm an outcomes-driven person. The bill, again, starts addressing the allocation of resources. But what we have found is that at least it's bringing some attention to this space. There's now some discussions going on about value. That's not necessarily the intent of that law. The intent of that law was to get people insured. Well, you got them insured, but for the healthcare stakeholders, a large hospital group, someone who might be insured with a huge deductible plan, in their eyes, are still not insured. For a simple case, if someone goes in with a broken arm to a hospital and the hospital says, I'll be $3,000, well, wait a minute, I've got insurance. Yeah, but your deductible is $10,000. I don't have $3,000. No, of course you don't. So I guess that could be an unintended consequence that it really hasn't solved the problem. But on the positive side, at least now there's some discussions on, hey, maybe we should start figuring out how to improve the outcomes of patients. Not do services all the time. How do we improve those outcomes of patients? How do we engage patients? What other methodologies are out there for CMS and such to incentivize us as a healthcare industry to provide those outcomes? I think it's the next iteration of healthcare legislation that I think will be probably the most interesting and we can only hope the most impactful on, again, driving the industry to be remunerated for improving the lives of our patients.